All right, everyone, we will now call to order this evening's meeting of the Champaign County Mental Health Board, Wednesday, May 27th, 2026 at 5:45 p.m. in the Shields Carter Room of the Bennett Administrative Center, Urbana, Illinois. May I have a roll call, please?
Den Arez.
Present.
Alejandro Gomez. Tony Nichols. Elaine Plencia.
Here.
Kyle Patterson.
Here.
Jane Sprandel.
Here.
Jen Straub.
Yes.
John Paul Joachim.
Here.
Molly McClay.
Here. All right, we do have a quorum, so we can move on to approval of the agenda. We do need to make a couple amendments to the agenda this evening, so I will describe them and then ask the board if there were any other amendments to make. So the first item is under item 9, we have an additional set of minutes to approve. Thanks to the quick work of our staff, the minutes from the May 20th, 2026 study session, which are on pages 1 through 3 of the addendum, are available to approve in addition to the other minutes that are listed. So we will also, make note of that in that section with that motion, but we will amend the agenda such now. And then the other item is for item 12A, this is the evaluation capacity building project update. There was a conflicting interview happening today, so we discussed things with Dr. Dariotis, and she's going to be moving her update to July or sometime in the near future. So we will not have that update this evening. And while I'm sad about that, we have a lot of business tonight, so that will give us some time. Are there any other adjustments to the agenda that we need to make? All right, well, I will move to approve the agenda as amended. May I have a second? Okay, I think we had a few seconds, Erez, and maybe someone else. Erez seconds, McClay motions. Are there any final discussion items? All right, seeing none, all those in favor of approving the agenda as amended, say aye. All those opposed, same sign. The ayes have it. The agenda is approved as amended. Next, we will move to the 2026 meeting schedules and allocation timeline. These are on pages 5 through 8 of the packet. No action is needed, but do we have anything to discuss here, Lynn?
Since we've completed the packet, because we've been attending all kinds of accessibility trainings, and one of them was titled How to Make Your PDFs More Accessible, and the whole message was stop using PDFs, use web pages instead. We created a web page for the Mental Health Board meeting schedule. Since this, and I sent you all a link to it, but in the future board packets, we'll just link to that web schedule. And the IT staff are very happy about this. You should know when we get accolades from the IT staff.
That is great to know. I also wanted to make a note. So there is supposed to be a meeting on June 24th, and Lynn and I have discussed canceling that meeting because there is not going to be a lot of business at that point. We are going to do the elections tonight, and we could all use a break. Is there any opposition to canceling the June 24th meeting? I am hearing none. We do not need to do a formal vote, so that meeting, June 24th, 2026, is hereby canceled. Any other discussion about the schedules and timeline? All right, seeing none, we will next move to the CCMHB acronyms and glossary. These are on pages 9 through 20 of the packet. No action is needed, but Lynn, do we have any updates to this? Okay, any discussion from the board? All right, seeing none, we will next move on to public participation and agency input. As always, members of the public are welcome to share their perspectives with the Champaign County Mental Health Board. We cannot respond directly to public input, but we may use it to inform future actions. There are several ways that you can make public input. You can approach the podium to do so. You can fill out a comment card and hand it to me, and we already have one, so I will call that person forward first. If you're on Zoom, you can also participate by raising your hand or putting something into the chat to to let us know that you'd like to speak. Agency representatives and others providing input that might impact board actions should be aware of the Illinois Lobbyist Registration Act and take appropriate steps to be in compliance with the act. I do reserve the right to limit individual time to 5 minutes and total time to 20 minutes. So with that, I'd like to call Claudia Lenhoff forward to make the first public input. And then if there's anybody else who would like to do so, you can do one of those other methods after Claudia speaks.
Good evening. I'm Claudia Lenhoff, Director at Champaign County Healthcare Consumers, and I was reflecting on some things today, and I just wanted to express gratitude to the Mental Health Board, in particular tonight for the funding that we've gotten for the disability program. It's a program that has been years in the making and that I really wanted to start many, many years ago based on the need that I was seeing, and your funding has helped to make that possible. So I just wanted to express my gratitude on behalf of the organization and the people who we've been serving. And I just wanted to mention that so far this fiscal year, in terms of dollars that we've been able to bring to clients and to the community as a result of the work, we've gotten, I think, now this is based on the clients reporting to us. They're not required to do that. Many don't tell us, once they're approved, they don't tell us dollar amounts or anything like that. But of the ones who have shared information with us, we've helped secure about $360,000 in lump sum back pay. So this is money that helps people, start meeting all the unmet needs that they were going without for a long time. And then in terms of new monthly income, this is aggregate, across our clients, but in terms of new monthly income, it's around 180,000 that has been secured, and that's ongoing every month. And so that makes an enormous difference in people's lives. And so I just really wanted to express my gratitude. It's very, very difficult work, as some of you all know who've had to deal with interacting with Social Security. It's getting worse. It's getting harder. But one of the other side benefits of doing this work that I just wanted to mention is it's a great incentive for helping get people into the healthcare system, because we always have to explain to them that you might know your diagnosis, you might know your disabling condition, but if you're not going to get healthcare on a regular basis to document that, Social Security thinks it's disappeared. And so we really have to have you going to see your providers and continuing that medical documentation or mental health documentation, whatever it is. And so it's sort of another carrot for helping get people into care. And then usually once they start getting into the care, they tend to maintain that because they see the benefit of it. So anyway, I just wanted to express my gratitude. I've seen lives saved because of this program. And just one other thing real quick, part of the impetus for this years and years ago was actually I had a coworker who was waiting on disability, and he ended up committing suicide. He had to act because he got so hopeless, waiting and waiting and waiting. And he had actually already been approved for disability, but Social Security hadn't told him. And so 2 days after he committed suicide, I got a phone call from Social Security saying, we're trying to reach so-and-so, we're trying to deliver this good news to him. And he actually got approved, a month ago, but we haven't gotten the letters out. And so I wanted to make a personal phone call. And I had to let that lady know that it was too little, too late. But so that is just an example of how deeply important this is and how it can help save lives. So thank you very much. I appreciate the support and helping us get this program off the ground.
Thank you very much for your comment and for all you do. Is there anyone else in person or online who would like to make public comment?
We have two people online who have their hands up. The first to raise his hand was Jim Hamilton from Promise, and then Melissa Pappas also raised her hand from Rosecrans.
Okay, go ahead, Jim, with your comment.
Good evening, everybody. Thank you for letting me participate. I just wanted to make some points about our application for the mobile clinic and clarify some of our goals and our targets. I think in the last meeting, I got the impression that board members thought we were going to be diverting people to brick and mortar facilities, and that's not the case. We intend to use the mobile clinic to give people in areas that don't have access to healthcare, that don't have the resources to get to brick and mortar, to provide them care. I think it's important to note that we don't plan on just doing it in Champaign-Urbana, but we plan on going into the rural areas of Champaign County, which I think are often forgotten. Places like Gifford, Fisher, Tolono, Sedoris, Ogden, Homer, different outlying areas that there's a lot of people that don't have access to care, and the mobile clinic would bring that care to them. We intend to develop patients through our mobile clinic that we're seeing repeatedly. Certainly, some of those patients may be diverted to the brick and mortar facilities that we have, but our intention is to provide that care there. We plan on initially having behavioral health counseling, case management. We'll have enrollment staff there that can help people enroll in insurance, whether that be Medicare, Medicaid, marketplace insurance, whatever they might be available for. And I just wanted to read this little comment from the Mobile Clinic Association. Give me a second here and I'll bring it up. So this comes from the Mobile Healthcare Association. Mobile clinics bring much needed healthcare services to individuals who face significant barriers to access. Research shows that such clinics produce markedly improved patient outcomes as well as significant cost savings, in part by lessening the reliance of at-risk populations on hospital emergency departments for care. In the United States, an estimated 3,000 mobile health clinics operate in urban and rural areas, offering a range of care from dental, behavioral health, mammography, and pediatrics through more than 9 million visits. So I think mobile health clinics are on the cutting edge. I know they have very successful programs in Southern Illinois, another successful program in Western Illinois around Macon, and the Chicago area has dozens of different mobile clinic operations going on. I think the mobile health clinic here is an opportunity to really provide people without access to care, and I think it's really important. So I'd just like you to kind of consider my thoughts prior to voting. Thank you.
Thank you very much for your comment. Melissa, you may make your comment now as well.
Hi, thank you. First and foremost, I just want to thank you for allowing me this time to speak. I would like to announce that the Rosecrans Behavioral Health Urgent Care is having their open house on Friday, and it would be great to see you all there so you could see the space, get a tour of how the program will run, and then also be able to meet some of the staff that we will have there that will be working in that program. The event starts at 11:30, and I just hope that everyone can see a lot of the community input when we were creating this space, that they could see it playing out in real time for them. So I just wanted you guys to extend that invite to everyone, that the open house again is this Friday starting at 11:30 at our Moreland location, which is 2302 Moreland Boulevard here in Champaign. Thank you.
Thank you very much for your comment. Is there anyone else in person or online who would like to speak? All right, I don't see anyone in person, and it appears no one else online who would like to speak. But as always, there is a second portion later in the meeting where people can make public input as well. So I will let you know when that is. So next on the agenda is chairperson's comments. So I'm Molly McClay. I'm chair of the Champaign County Mental Health Board, although not for much longer. I know we have a long and tough meeting ahead of us, so I'll try to not take up too much time with my final comments as chair. However, since as of this week, I've been on this board for 4 years, and 2 of them as chair, I wanted to share a little bit about what this experience has meant to me, both personally and professionally, and also kind of tie it back to why we're all here doing this work. So as a therapist and social worker in this community for the last decade and a half, I did write these comments in advance so I can compose myself. I wanted to join this board to make a difference in our community in a broader way. So some of you may know this, but I know not everyone does. But ever since joining this board, I have been going through a pretty significant set of personal health and life events. My husband and I have been living through infertility and pregnancy loss for the entirety of my service on this board. We began our first treatments right around the time that I joined in 2022. When I opted to run for vice president 3 years ago, I was in the midst of several reproductive surgeries and was not sure what the future held for me. I was proud and excited to be able to serve in leadership, and soon after that, I became pregnant. My due date was set to be around the time of the June 2024 board meeting when elections would be. So I thought my leadership on this board would come to an end at that time. Unfortunately, on Valentine's Day 2024, I gave birth to a stillborn baby, lovingly named Dolly Pippa. It was simultaneously the worst and best day of my life. It's an experience that will forever shape how I interact with the world and how I view my life and its purpose. It has taught me more about grief, pain, and love than anything else ever could. When Dolly's due date came up in June 2024, I was obviously in mourning. I also realized that I had an opportunity I did not expect. I realized that I could do something with the time I was given, time Dolly didn't have herself, and time I didn't think I would have available. I could continue my service to this board and this community in a way I wouldn't have been able to had she lived. It felt both cruel and meaningful that this happened at the time of her due date, but it felt like that meant something. So I decided to run for president, and ever since I've thrown myself into this role and given it everything I have. We're all doing our best to make meaning in our lives, including during our darkest hours. This is why we're all here, whether we're board members, service providers, or staff, or anyone in this community. We're dedicated to helping others find and make meaning in their lives too. To be a flashlight in a mirror through hard times. And sometimes we need that flashlight and that mirror ourselves. And being on this board and being the chair has reminded me of who I am and what I stand for during the most difficult experience of my life. Serving as your chair is one of the most important things I've done since losing my daughter, one of the best ways to spend my time and effort. I try my best each day to think to myself, how can I live my life in accordance with my values? And how can I live my life in a way that would make my daughter proud? I know that Dolly would be proud of me and of all of us who are here, and she would want our community to take care of everyone's mental health. So I just wanted to share, since I haven't publicly talked about her here, it is in her honor that I do this work ever since then and for now and for always. And I know that each and every one of us has our own why, our own reasons for what we do, and the way we make meaning and build each other up in this broken world. And for every single one of us here tonight and those who aren't here, I'm grateful for who you are, what you do, and the ways you make meaning. Thank you for giving me the opportunity to be on this board and to be your chair, and thank you for listening and hearing my story and Dolly's story. That concludes my comments. I am glad that Lynn is next, so I have a minute to compose myself. So next we have Executive Director Lynn Canfield's comments.
Wow, I think I need the minute. Thank you. That was really lovely.
I warned Lynn
You
that
did.
she would be after that. So
You did warn me, and I have nothing to say after that. Was really beautiful, and it's true that we're here for all kinds of reasons, and some of us know the reasons right up front, and some of those reasons are discovered as we do it. So after you warned me about it, I thought about that. I contemplated talking about that, but I think it's okay just to say that. Like this, even just this process that we engage in where we have to look for negatives and talk about negatives, and that's probably not where our hearts are at all. Just going through that so that we can make the best possible decisions is so hard. And I was trying to think about like what do I learn from that that's helpful? Like what is the personal benefit from this? I haven't quite figured it out yet, but the purpose of this board and the purpose of the DD board are essentially to keep people in their communities. And that's really important to me. So I think I'm just going to settle with that. We have pretty healthy funds. They're obviously not enough to go around, not enough to meet all the needs, but they are enough to support some substantial programs that do keep people in their home communities. So did I buy you enough time?
yes.
Okay.
Thank you very much, Lynn, for your comments. So next, we will move to approval of the CCMHB board meeting minutes. The minutes are on pages 21 through 26 of the packet, as well as pages, darn it, I wrote this down, 1 through 3 of the addendum. So action is requested to approve the minutes of the CCMHB April 22nd, 2026 meeting, the April 29th, 2026 study session, and as amended by the agenda amendments earlier, the May 20th, 2026 study session minutes as well. There are a couple of typos that I noted that I wanted to also make as an amendment. Can I just tell you those later, Lynn, or should I read them out loud? Okay. And then of course, if there's any other amendments to the minutes, we'll open it for discussion. But on April 22nd, I think there's a couple of last name misspellings, Hernandez and Murray. I don't have the exact page numbers open at
So
this is April 22nd under the members present. It's page 21. Thank you.
Hernandez and Murray.
Yes, I think it's listed as Morley, but I think that's Murray.
Okay.
And I think Hernandez is missing
Okay.
an N.
And Murray. Okay.
Yes. And then I did not see any on April 29th, but on the May 20th, Cunningham under Cunningham Children's Home is missing a G.
Yep.
That is all I noted. Are there any other amendments?
It's missing a what?
A G in Cunningham.
Oh, I see it. Okay, got it. And then there's Marlon Mitchell is listed twice on April 20th.
Oh, okay.
Okay.
Good.
So I've
good
got
to
all
also
those.
know. Any other amendments to the minutes? All right, seeing none, I'll go ahead and make this motion since it's been amended several times. I move to approve the minutes of the CCMHB April 22nd, 2026 meeting, April 29th, 2026 study session, and May 20th, 2026 study session as amended.
Second.
Thank you very much. McClay motions, Straub seconds. Any final discussion? The motion has been clearly stated. All those in favor say aye. All those opposed, same sign. The ayes have it. The minutes are approved as amended. Next, we will move to the vendor invoice lists. These are on pages 27 through 30 of the packet. Action is requested to accept the vendor invoice lists and place them on file. Any discussion, or would anyone like to make a motion?
Motion to approve the vendor invoice list?
Thank you very much. Any second?
I second.
All right, Ara's motions, and there's a tie for seconding between Joachim and Valencia. Any final discussion? All right, all those in favor of accepting the vendor invoice list and placing them on file, say aye. All those opposed, same sign. The ayes have it. The vendor invoice lists are accepted and placed on file. All right, next we will move to the big item on the agenda under old business. This is the program year 2027 funding allocation decisions. And these are in the addendum beginning on page 4 of the addendum. And I'll just also make a note that the program year 2027 funding request and scenario, or the second item of old business in there, this like a spreadsheet that lists those out, is the very last page of the addendum. So that is what the addendum consists of in full. So just to start, a decision memorandum has been posted as addendum to this packet, presenting an affordable scenario for funding awards for the program year 2027. Action is requested. Many actions are requested. And then the spreadsheet has the suggested allocation awards kind of all listed out on that final page of the addendum. So basically, just to start, we're going to kind of start going through this this memo in the addendum. There's some kind of larger piece, like organizational pieces, like to discuss. Then there's going to be a set of like overarching motions that govern like the contract process. There's 4 motions. These are on pages. Well, I've numbered all my pages based off the PDF, but the pages of this memo that contain these are on pages 7 through 8. That's the kind of overarching motions that we'll make, and then we will get into the each application, their request, and there's a suggested motion available. But please note, like, we have the opportunity to change. We can make any motions and change anything like as we go along up until the point that we vote. However, I did want to state that this version of the memo is consistent with what was presented last week. Given board consensus, nothing has really changed, other maybe some minor details. I also wanted to make a note, because I don't think this is something that I learned through the memo that hasn't really been emphasized, is that I know a lot has been talked about how there's a difference between what was requested and what we have available. However, we are still funding like $500,000 more in requests than we did last year. So I just think that that's really important to note, that like we are funding more. It's just the need for services, the growth in the request far outmatched the growth that we have available in our fund. But I did want to acknowledge that we are still funding a lot. And I did like total everything up. And if the total still matches what this scenario brings, I'll tell us the grand total at the end of going through all of these. So I want to turn it over to Lynn briefly to just kind of talk through like the overarching parts of the memo, and then we can start entertaining those like larger 4 motions that govern this process.
Okay, I think most of you are familiar with it. Why is it happening? Sorry, I meant to open the video, not, thank you. Because that had the threat on the side, like that was going to start being really painful. Thank you for helping. So you're familiar with a lot of this, like there are statements about why, where your authority comes from. It is essentially a state law. Changes a little bit every year. People keep messing with it, but essentially your role is the same. It's to ensure that supporting a system of services for people who have mental illness, substance use disorder, or developmental disabilities in this county. And there's so many ways to do that. So just the statements are regarding your authority and the process. These are also described in other memos in your funding requirements and in the statute. So there's just kind of reviewed all that. Then going backward to it didn't reprint all of the priorities memo from November, but just references to it and how you got to those priorities through some study sessions that were really interesting last fall. It was a lot of extra time that you put in, but it was really cool to hear from people who don't normally come and talk to us about what could really help them. And some of the answers were unexpected. So that helped to create the foundation for that. The agencies all have access to this information too. Some of them knew way more about it than I did. So we hope to see applications that address some of that. And then we review things like longstanding commitments. The one between the two boards, the Mental Health Board and the DD Board, is described in here, detail that I'm sure everybody knows. Our relationship to other public systems, it's sensitive. We all sort of need each other and we all fall together. The local governments are really having a hard couple of years as they are expected to take on more and more of the safety net responsibilities. And you can talk about cost shifting from one system to the other, but I think all of us don't want to see people who could benefit from mental health treatment languishing in jail. So that's one of the longer standing collaborations here, us and law enforcement. So anyway, then we also have the multi-year contracts, a whole bunch of 2-year contracts. They're roughly the same number of contracts and not exactly the same amount of money that you're reviewing, every other year. The idea of doing that was to offer a little bit of stability to the agency programs and reduce a little bit of the repetitive review work that y'all do. So then I broke down under each major priority how many applications you had and what their total. I don't know if that's even interesting or helpful since there were so many really compelling proposals this year. Anyway. And then the discussion of budget impact goes back many years to kind of talk about how we've been able to put more and more money into the system every year. I don't know if we'll always be able to, but that's worth celebrating despite how hard the coming decisions might be. And then there's just some calculations in here of interest. You obviously read it and found one that was interesting to you. Yay. So then here we are at the contract negotiations and special notifications. Some of these things are standard to the contracts, but we do not just put them in the contracts without your approval each year, mostly so that everybody knows what we're getting into. And actually, a lot of the content of this memo is to show you what we are getting into. Anyway, okay.
Lynn, what I would like for you is kind of for each of these 4 kind of broader motions, if you could just kind of explain what the first one is, and then I'll ask for anybody to make a motion. And if you, as you're reading along in your packet, see suggested motion and you feel compelled to make it this, the faster we can make motions, the smoother this will go.
Well, I've already talked too long. So contract negotiations are sort of standard. After you make decisions about awards, we have added some conditions in these, like where there might be something that needs to be completed or something that we want to see that program do during the year. Those are detailed here. We'll have conversations with agencies. Some will send them an email and they'll send it right back. Great, accepted. But sometimes there are difficult conversations to have. So if we can't get to a resolution about a program, we might come back to you and say the contract negotiation failed. What do you want us to do? So these are standard, and it's been a really long time since I had to talk to you about a failed contract negotiation. So hopefully it'll be smooth again this year. So that's the first one.
Thank you very much. Would anyone like to make a motion on this?
I'll make a motion to authorize the executive director to conduct contract negotiations as specified in this memorandum.
And anyone like to second?
I second.
Thank you very much. Sprandl motions are as seconds. Any final discussion on this one? All right, since these are around financial issues, I think we should probably take a roll call on these. That's what I had noted from prior years. So the motion has been clearly stated. May I have a roll call?
Jen Arez,
Yes.
Elaine Palencia,
Yes.
Kyle Patterson,
Yes.
Jane Sprandl,
Yes.
Jen Stroud,
Yes.
John Paul Joachim,
Yes.
Molly McClay.
Yes. With that, the motion passes. The executive director is authorized to conduct contract negotiations. All right, what is the next one, Lynn?
We'll call this the doomsday scenario. This is, there are a few reasons that revenue estimates might fail. We don't know for sure what the revenues for 2027 will be until quite late in the year. That has to do with the county board has a process, and they do the final appropriation. We can ask for what we think we need, but they have to make the final approval of that. And there are a lot of things that could affect that. Low collection rate this year could affect next year's revenues. So, I mean, there's also, I just don't even want to say it. This happened once. I'll just say that. It happened once since I've been here. I don't know if it happened before that. But there was one year, and I'm not going to name the year, that we did need to make reductions to a number of contracts. It was right after you had approved contracts and we had negotiated contracts and got the first payments out, we needed to make some changes. So that's really doomsday. So there's language in every contract that there's an out clause if our revenue estimates fail.
All right, thank you. I will go ahead and move to authorize the executive director to implement contract maximum reductions as described in this memorandum. Can I have a second?
I'll second.
Thank you very much. McClay motions, Sprandl seconds. Any final discussion? The motion has been clearly stated. May we have a roll call?
Elaine Palencia,
Yes.
Kyle Patterson,
Yes.
Jane Sprandl,
Yes.
Jen Stroud,
Yes.
John Paul Joachim,
Yes.
Jen Arez,
Yes.
Molly McClay.
Yes, with that, the motion passes. We have authorized the executive director to implement contract maximum reductions. All right, what is the third one?
And this one is, this is overstating something that's stated in other places. It's even in the funding guidelines itself that the board has the authority to approve a provision to waive a requirement that's listed in the funding requirements. This year you had an agency telling us what their financial review is going to cost. It's a little bit more than the funding requirements threshold is. And we've talked about it a lot, but like the final word is the contract. And so this is just a restatement of that so that everybody's clear that the contract prevails over other statements.
Thank you. And anyone like to make a motion?
I motion to include in all contracts a provision for specific exceptions to funding requirements and guidelines as described in this memorandum.
Anyone second?
Second.
Thank you very much. Ara's motions, Joachim seconds. Any final discussion? Seeing none, the motion has been clearly stated. May we have a roll call?
Kyle Patterson,
Yeah.
Jane Sprandl,
Yes.
Jen Stroud,
Yes.
John Paul Joachim,
Yes.
Jen Arez,
Yes.
Molly McClay.
Yes. With that, the motion passed. Oh, whoop.
Oh, Elaine Palencia, sorry.
Yes.
All right, now I can officially say with that, the motion passes. We are including this provision for specific exceptions. All right, the last one of these broader motions.
This last one was new last year, and a lot of folks didn't do it. So we're just going to ask again. Documentation of the beginning of CPA engagement will be really helpful to us because we do think that some organizations are getting, the red carpet treatment, and others are not. So we kind of want, before we, really like come down on someone for a late audit, we want to understand what happened. And if they don't start the audit in a timely manner, that might be on them. So it would be very helpful, I think, for y'all in the future to know the difference. Anyway.
Yes. All right. I will move to include in all contracts the requirement to share documentation of the onset of work on the audit review or compilation as described in this memorandum. May I have a second?
I will second that.
Thank you very much. McClay motions, Sprandel seconds. Any final discussion? Seeing none, the motion has been clearly stated. May I have a roll call?
Jane Sprandel,
Yes.
Jen Straub,
Yes.
John Paul Joachim,
Yes.
Jen Arez,
Yes.
Elaine Palencia,
Yes.
Kyle Patterson,
Yes.
Molly McClay.
Yes. All right. With that, the motion passes. All right. Now we are moving on to the actual allocation scenarios and voting on each one. I just will kind of briefly outline how we'll go through these. So I will state as we move through them, I'll state the application, whether it's new or returning, and the amount of the request. I will then ask Lynn if there's any summary of the suggested scenario or provisions that she would like to share. We can have discussion before and after motions are made for any and all of these. There is a suggested motion available, but again, if we do need to change that, I would say if anybody is entertaining something outside of what's been suggested here, maybe make a note in the discussion prior to making a motion so we are prepared. Does anyone have any questions or concerns on the board? And Lynn, do you have any questions or concerns? All right. I also just wanted to mention that for the applications that are being recommended for funding, almost all of them are being recommended to be offered a 2-year term. We can also change that. There is one that we're recommending to just have the 1-year term to help potentially get it on alignment with the other application, all the ones that are coming into their 2nd-year term this coming year. So I just wanted to mention that. No program has to take the 2nd year of the term though, but it's just giving us the authorization to offer that. So we will start with Brightpoint Healing Beyond Violence. This is a new request for $217,106. Lynn, would you please summarize the scenario and provisions, or whatever you want to say about it?
I hope it's kind of summarized already. We just put, if you did fund this, what we'd want to see them do before the contract and then during the contract year. Y'all have had plenty of discussion about it. So I think that's, yeah. Okay.
All right. So the current suggestion in this memo is to deny funding. Is there any discussion or would anyone like to make a motion?
I motion to deny the CCMHB funding of $217,106 for Brightpoint Healing Beyond Violence.
Thank you very much. May I have a second?
Second.
Thank you very much. Ara's motions, Palencia seconds. Any final discussion? All right. The motion has been clearly stated. May I have a roll call?
Jen Straub,
Yes.
John Paul Joachim,
Yes.
Jen Arez,
Yes.
Elaine Palencia,
Yes.
Kyle Patterson,
Yes.
Jane Sprandel,
Yes.
Molly McClay.
Yes. With that, the motion passes. Funding is denied. Next, we have CCRPC, Community Services Homeless Services System Coordination. The request is for $189,007. Lynn, would you please share anything of note about this one?
The only prior to contract issues would be the new indirect cost plan letter, which I think they send that to us usually immediately. So I think it hasn't happened yet, but we want to see that soon. Contract provisions, I believe, are quite similar to prior years. This is collaboration is really like key to the service, so it's almost silly to put that in there because it's kind of what they're proposing to do, but we want to make sure.
All right, thank you very much. So per our discussion last week, the consensus was to fully fund this one. Is there any discussion or would anyone like to make a motion?
I motion to approve CCMHB funding for $189,000 and $7 per year for a 2-year term for CCRPC Community Services Homeless Services System Coordination, subject to the caveats as presented in this memorandum, and to authorize the CCMHB Executive Director and Board Officer to execute the agreement.
Thank you very much. I will second. Any final discussion? All right, seeing none, the motion has been clearly stated. May I have a roll call?
Yes.
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 Yes. All right, with that, the motion passes. Funding is approved. Next, we will move to See You at Home, Life Skills Case Management. This is a new request, and the request is for $305,000. Also, I failed to say that the prior request for CCRPC was a returning program. I'll try to say that, but it does say new right in front of me, so it's a good reminder. But okay, so I will go ahead and say this again. See You at Home, Life Skills Case Management, new request for $305,000. Lynn, would you share the suggested scenario and any provisions for this one?
This one is suggested for denial mainly because it's a new program, and I think I heard y'all about new programs, if any at all, right? Okay.
Thank you very much. Is there any discussion or would anyone like to make a motion?
I move to deny CCMHB funding of $305,000 for See You at Home Life Skills Case Management.
Turn on my mic at the same time as you, Elaine. Do you want to say that again?
Yes.
Thank you very much. Ara's motions, Palencia seconds. Any final discussion? All right, seeing none, the motion has been clearly stated. May we have a roll call?
Jen Arez,
Yes.
Elaine Palencia, Kyle Patterson,
Yes.
Jane Sprandel,
Yes.
Jen Straub,
Yes.
John Paul Joachim,
Yes.
Molly McClay.
Yes. With that, the motion passes. Funding is denied. Next, we will move to See You at Home Shelter Case Management. This is a returning program requesting $295,000. Lynn, would you share the suggested scenario and any provisions?
Just to collaborate more closely with the coordinated entry system, I think that's one of the things with the crisis in this community getting worse and worse. I'm glad if y'all support some of these programs pointed at unhoused people. I think that's really timely and that they should work together as much as possible. So that's the most important special provision in there. They already are at the table for these other collaborations. So just continuing other special provisions.
Thank you very much. Any discussion on this, or would anyone like to make a motion?
I'll make a motion to approve CCMHB funding of $295,000 per year for a 2-year term for See You at Home Shelter Case Management, subject to the caveats as presented in this memorandum, and to authorize the CCMHB Executive Director and Board Officer to execute the agreement.
Thank you very much. I will second. So Sprandel motions, McClay seconds. Any final discussion? All right, seeing none, the motion has been clearly stated. May we have a roll call?
Elaine Palencia,
Yes.
Kyle Patterson,
Yes.
Jane Sprandel,
Yes.
Jen Straub,
Yes.
John Paul Joachim,
Yes.
Jen Arez,
Yes.
Molly McClay.
Yes. With that, the motion passes. Funding is approved. Next, we will move to See You Early. See You Early, this is a returning program requesting $86,701. Lynn, would you share the suggestion and any provisions you'd like to share?
We just talked. Oh, I think we just talked about it last week. It seems so familiar. So the big news is that the DD board did meet this morning and did recommend that you use DD set aside money to support a portion of this program and then the next one too. So yay. I think if I heard you right, you know, it was a lot of strong support for both of these programs as they pay off big in the future.
All right, thank you very much. Is there any discussion or would anyone like to make a motion?
I will move to approve the CCMHB funding of $86,701 per year for a 2-year term for CU Early, subject to the caveats as presented in this memorandum, and authorize the CCMHB Executive Director and Board Officer to execute the agreement.
Thank you very much. May I have a second?
Second.
Thank you very much. Joachim motions, Straub seconds. Any final discussion?
I would just say all these programs are amazing that we were, you know, funding, and even the ones that we're not funding this year, but this one is one I truly love. It's close to my heart and I see the fruits of the labor that they are doing, and they're doing great work. So I just wanted to mention that.
Thank you very much. Any other discussion? I completely concur about this program, as well as like all of these programs are excellent. I think we, you know, kind of had the hard discussion about how painful this is last time. And I think I want to acknowledge that it's painful right now to actually vote on these. But I agree that, you know, everything in front of us is a wonderful program. And I wish that we had infinite money to fund everything. Any final discussion? All right, seeing none, the motion has been clearly stated. May we have a roll call?
Kyle Patterson,
Yes.
Jane Sprandal,
Yes.
Jen Straub,
Yes.
John Paul Joachim,
Yes.
Jen Aras,
Yes.
Elaine Valencia,
Yes.
Clay.
Yes. With that, the motion passes. Funding is approved. Next is Champaign County Head Start Early Childhood Mental Health Services. This is a returning program requesting $411,062. Lynn, what can you share about this one, the suggestion and any provisions? As you already did share something, but.
It's a continuing program, and so the special provisions are also continuing. There's no new provision. Again, the DDB likes it. We think full funding. The staff had done some site visit there not too long ago and also felt comfortable to endorse the program. That was really meaningful to me. I think the maybe just specific targets on outcomes was the biggest pre-contract condition.
All right, thank you. Is there any discussion or would anyone like to make a motion?
I motion to approve Champaign County Mental Health Board funding of $411,000 or $4,011.62. That comma's hard per year for a 2-year term for Champaign County Head Start Early Childhood Mental Health Services, subject to the caveats as presented in this memorandum, and to authorize the Champaign County Mental Health Board Executive Director and Board Officer to execute the agreement.
Second.
Oh, yeah.
Oh, go
No,
ahead.
you're good.
All right, thank you very much. Straub motions, Aras and Joachim both seconds. Any final discussion on this one?
Just do I understand from these numbers that that's the total amount, but that some of that comes from the set aside, and then so we're paying $165,699.
So you are looking at the spreadsheet where we
Yeah.
did define the proportions that we would.
But the motion should say the total. That's my
Yeah, the total, it's all mental health board dollars. It's just we want to make sure that you are able to fully spend the DD dollars since you don't have,
yeah.
you know, ample mental health dollars. Okay.
Thank you very much. Any other discussion? All right, seeing none, the motion has been clearly stated. May we have a roll call?
Jane Sprandal,
Yes.
Jen Straub,
Yes.
John Paul Yoakim,
Yes.
Dan Aras,
Yes.
Elaine Palencia,
Yes.
Kyle Patterson,
Yes.
Molly McClay.
Yes, with that, the motion passes, funding is approved. I'm having a little trouble tracking. I'm like, is everybody voted? Because I'm so used to like the pacing of what it feels like to have eight people before me. And tonight there's only 6 and I just could be like, ah. But we're all good. So next we will move to Champaign County Healthcare Consumers Disability Application Services. This is a returning program requesting $121,000. Lynn, would you share the suggestion and any provisions for this one?
There's just a really small update within the program plan narrative of a detail for the TPC definition. That's really small. Similar special provisions to the prior years because this is a continuing program, but we also wanted to have a stronger relationship, coordinated entry, if appropriate. It's not always appropriate, but healthcare consumers is very involved with that work, so they'll know when it's appropriate.
Right, perfect. Any discussion or would anyone like to make a motion?
I'll make the motion to approve CCMHB funding of $121,000 per year for a 2-year term for Champaign County Healthcare Consumers Disability Application Services, subject to the caveats as presented in this memorandum, and to authorize the CCMHB Executive Director and Board Officer to execute the agreement.
I will second. So Palencia motions, McClay seconds. Any final discussion?
Can I just say that we're spending $121,000 a year, and Claudia Lenhoff said that our community members are getting a total of $180,000 a month. That's over $2 million. So the return for every dollar we spend is astronomical.
I am glad that you made that point. I completely agree. Any other discussion on this one? As we always say with public input, we cannot just respond directly to public input, but we may use it to inform future actions. So with that, the motion has been clearly stated. May we have a roll call?
John Paul Yoakim,
Yes.
Dan Aras,
Yes.
Elaine Palencia,
Yes.
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 Yes, with that, the motion passes. Funding is approved. Next, we will move to City of Champaign Township Stride Shelter Behavioral Health Program. This is a new request for $150,000. Lynn, would you please share about the suggested scenario and any provisions?
I know this is really tough one for some people to deny, and I think it was hard for us to suggest denial, but that's where we're at. To us, it would be a new program. There's a list here of, if you do fund it, what we would like to see them do prior to the contract and during the contract year. But anyway, it's
All right.
kind of outside the affordability. Yeah.
Thank you very much, Lynn. Is there any discussion or would anyone like to make a motion?
I'll make a motion to deny CCMHB funding of $150,000 for City of Champaign Township Stride Center Behavioral Health Program.
Thank you very much. Can I have a second?
Second.
Thank you very much. Brandel motions, Palencia seconds. Any final discussion?
I would just hope that they also apply next year.
That was my sentiments too. Like many of these others that we don't have the funding, I hope that they take the current application and move forward, and hopefully we'll win the lottery in Champaign County. I don't know.
I completely agree. Any other discussion?
This was discussed robustly last week, but I think most of us were very, very impressed with the additional information they provided after their application. And it's clear that a lot of work and a lot of time went into providing that information. And I really hope that is helpful next year, because this is going to be the hardest vote of the night for me.
Thank you very much. Any other discussion? All right, seeing none, the motion has been clearly stated. May we have a roll call?
Jen Arez,
Yes.
Elaine Valencia,
Yes.
Kyle Patterson,
Yes.
Jane Sprandel,
Yes.
Jen Straub,
Yes.
John Paul Yoakim,
Yes.
Molly McClay.
Yes. With that, the motion passes. Funding is denied. Next, we will move to Courage Connection. Courage Connection, this is a returning program requesting $176,476. Lynn, could you share the suggested scenario and any provisions?
I think, Leon, tell me if I'm wrong. I think these are the same special provisions as the current year. This has been a 2-year contract the last few times. And so as a longstanding program funded by the Mental Health Board, we did suggest a 2-year contract for this one also. There are just a couple of changes to make in the application forms.
And okay, so is there any discussion, or would anyone like to make a motion?
I move to approve Champaign County Mental Health Board funding of $176,476 per year for a 2-year term for Courage Connection. Courage Connection, subject to the caveats as presented in this memorandum, and to authorize the Champaign County Mental Health Board Executive Director and Board Officer to execute the agreement.
Second.
Thank you very much. Straub motions, Patterson seconds. Any final discussion? I just wanted to say that, I know we had a lot of discussion back several months ago about if we should establish a second notice and funding availability so Courage Connection could apply. And I know there was a lot of discussion of that, and I was not in favor of it. But when we made the decision to do that, it was important that we not see this application differently, because we made that decision that we're going to allow, and we have to treat all of the applications the same. So I do support this application and these services in the community. And I think, when we are making the decision as the board to make a second application period or to make extensions, like when we make that call, we can't like double dip. We can't then be like, well, we're going to like look at it as a lower priority. We're accepting it as any other application. So I just wanted to say that. Is there any other discussion on this one? All right, with that, the motion has been clearly stated. May I have a roll call?
Elaine Valencia, Kyle Patterson,
Yes.
Jane Sprandel,
Yes.
Jen Straub,
Yes.
John Paul Yoakim,
Yes.
Jen Arez,
Yes.
Molly McClay.
Yes. With that, the motion passes. Funding is approved. Next, we will move to Cunningham Children's Home, Echo Housing and Employment. This is a returning program requesting $264,351. Lynn, would you please share the suggested scenario and any provisions?
This one has, it as a continuing program, which has been on a 2-year cycle for a while, continues the same special provisions except with the stronger engagement or stronger participation in the coordinated entry system and other homeless services planning. And then just some updates to the application forms. That's it.
All right, thank you very much. Is there any discussion, or would anyone like to make a motion?
I will move to approve CCMHB funding of $264,351 per year for a 2-year term for Cunningham Children's Home, Echo Housing and Employment, subject to the caveats as presented in this memorandum, and to authorize the CCMHB Executive Director and Board Officer to execute the agreement.
I'll second that.
Thank you very much. Palencia motions, Sprandel seconds. Any final discussion? All right, seeing none, the motion has been clearly stated. May we have a roll call?
Kyle Patterson,
Yes.
Jane Sprandal,
Yes.
Jen Straub,
Yes.
John Paul Yoakim,
Yes.
Jen Arez,
Yes.
Elaine Valencia,
Yes.
Molly McClay.
Yes, with that, the motion passes. Funding is approved. Next, we will move to Cunningham Children's Home, Family Stronger Together, a returning program requesting $298,532. Lynn is sharing the wrong screen. That is okay. Lynn, when you are ready, can you share? Okay, will you share about the suggested scenario and any provisions?
Similarly, as a program continuing from the last few years, there are no new special provisions and just a few updates within the plan. I appreciated the board's very thoughtful discussions of this one. This was really a journey. And I also appreciated the agency's willingness to hear the board. So yay, but I do, in the end, I think the staff came out sort of strongly in favor of full funding for this one because it's a population who are really struggling in this community and don't have a lot of good options. So if the conversation between the board and the agency bears fruit and the agency is able to find better ways to reach this population, we will be celebrating next year, but I just felt like it's too soon to give up on them, so.
Thank you very much. Any discussion? So I will go ahead and move to approve CCMHB funding of $298,532 per year for a 2-year term for Cunningham Children's Home, Family Stronger Together, subject to the caveats as presented in this memorandum, and to authorize the CCMHB Executive Director and Board Officer to execute the agreement. May I have a second?
Second.
Thank you very much. McClay motions, Straub seconds. Any final discussion?
I would like to agree much what Lynn has stated. This was a tough one, but I also recognize it's a tough population. And so you have my prayers, my faith, and my juju, whatever you want to call it, that we believe in the program. We just have to hope that the ones we're trying to serve will be receptive to this help.
Thank you very much. Any other discussion? I just wanted to say, I know we'll get to it in the quarterly reports, but a lot of the utilization categories and like how they're meeting their targets is like going pretty well so far this year. So I just wanted to note that. Any other discussion? All right, seeing none, the motion has been clearly stated. May we have a roll call?
Jane Sprandal,
Yes.
Jen Straub,
Yes.
John Paul Yoakim,
Yes.
Jen Arez,
Yes.
Elaine Valencia,
Yes.
Kyle Patterson,
Yeah.
Molly McClay.
Yes, and with that, the motion passes. Funding is approved. Next, we will move to Don Moyer Boys and Girls Club, CU Change. This is a returning program requesting $94,135. Lynn, what can you share about the suggested scenario and provisions?
There's nothing really new in this one either. It continues the special provisions that we've had in there for a while. One thing that there was a very strange discrepancy that I think will be very easy for them to fix. So I think we made a real big deal about it, but it's just a mismatch of numbers. Otherwise, I think, financial forms needed some clarification. That's it. And a 2-year, we recommend a 2-year term for this one, just as an organization that has been doing this for a while, and we would hope to stabilize. It's also pointing toward a little bit difficult to reach group of kids.
Thank you very much. Is there any discussion, or would anyone like to make a motion?
I'll make a motion to approve CCMHB funding of $94,135 per year for a 2-year term for Don Moyer Boys and Girls Club, CU Change, subject to the caveats as presented in this memorandum, and to authorize the CCMHB Executive Director and Board Officer to execute the agreement.
I will second. Sprandall motions, McClay seconds. Any final discussion? All right, seeing none, the motion has been clearly stated. May we have a roll call?
Jen Straub,
Yes.
John Paul Joachim,
Yes.
Dan Arez,
Yes.
Elaine Palencia,
Yes.
Kyle Patterson,
Yes.
Jane Sprandall,
Yes.
Molly McClay.
Yes, and with that, the motion passes. Funding is approved. Next, we will move to Don Moyer Boys and Girls Club Community Coalition Summer Initiatives. This is a returning program requesting $100,000. Lynn, would you share about the suggested scenario and any provisions?
The only change, and I talked about this last week, is we'd like to, if we can, get that first payment out a little quicker than we've done. Chris Wilson was all for it, but we looked at, historically, it doesn't look like this contract gets signed as fast as we'd like it to, so we're gonna, right, Leon's already working on that. Just would be helpful since the programs start like in now. Okay, so we want to, folks are waiting to know if we would be paying for any of it. It'd be great to do that. So that's the only big thing. Then there's another change that I'd like to make from the way we've done it traditionally, but you guys might like the way we've done it traditionally, which is that they come in the winter, maybe October, November, or December, and give a presentation on what they've done with these funds. And it's pretty cool. My suggestion was maybe during contract negotiations, we talk about, they just do a year-end program report like the other agencies instead of a presentation. But then I started remembering how cool the presentation is. So if you don't like that part of it, anyway.
All right, thank you very much. We can definitely discuss that provision now as a board if we want there to be any changes, or if anyone would like to start by making a motion, that is also fine.
Motion to approve CCMHB funding of $100,000 per year for a 2-year term for Don Moyer Boys and Girls Club Community Coalition Summer Initiatives, subject to the caveats as presented in this memorandum, and to authorize the CCMHB Executive Director and Board Officer to execute the agreement.
I second.
Thank you very much. Palencia motions are as seconds. Any final discussion?
I appreciated that they were one of our agencies that did say they could accept a little less. But it was one of those things where we all know even a little cut here and there wasn't going to help cover an entire program of other things. And I just really feel like this program's had a good track history. And like we said, it's really hitting some of our core demographics that really need our help right now so that they continue to blossom how they're supposed to.
Thank you very much. Lynn, I just wanted to clarify. So is the current part of it is there's a lot of words and I'm doing a lot of thinking. So is the current recommendation to do this year-end report versus the presentation?
I didn't say anything in these details about not having the presentation, so you could potentially do both, but it has been difficult sometimes for them to schedule, and it's a longer presentation. It's just, it's such a different program from the others that we have not had an easy time of fitting it into the written report. So this is just kind of an idea, like we could, yeah. I mean, they could probably do something with that year-end report, and then we could say, yeah, we still want you to come and do a presentation, but it's just, yeah.
I guess if there's not a strong preference from the board, can that just be part of the contract negotiations that we authorize you to do to kind of work with them to kind of make the call on if it's a presentation or a report?
Or it could just be something later in the year, the board says, man, I really want to hear about the summer programs, because they would probably do it just if you asked, right? Like,
Yeah, It's just an email, but part of the challenge for them is just getting the scheduling it later in the year. So it's your call.
My thought was it might take the pressure off if they just report like everybody else, but it might not work. So if you're okay with us just kind of playing that by ear, we could make that special provision a little flexible.
I kind of feel like we shouldn't have that provision for one agency if we don't have it for every agency. And with a proven track record now, maybe we could just let it slide for one funding cycle. And if it needs to come back again, that it can be discussed by another board.
You mean the presentation?
Yeah, I would agree with that. All right, and we don't need to amend anything because that's not part of the motion.
And I can certainly discuss with them in contract negotiations. And I think one less project might be attractive to a busy agency.
But please let them know it's not because we don't like to see them.
We're just trying to give them less work or different work, maybe. Okay. Any other discussion on this? All right, it's been a while since we said the motion, so I'm going to go ahead and repeat it and then ask for the roll call. The motion on the table is to approve CCMHB funding for $100,000 per year for a 2-year term for Don Moyer Boys and Girls Club Community Coalition Summer Initiatives, subject to the caveats as presented in this memorandum, and to authorize the CCMHB Executive Director and Board Officer to execute the agreement. May we have a roll call?
John Paul Joachim,
Yes.
Jen Arez,
Yes.
Elaine Palencia,
Yes.
Kyle Patterson,
Yes.
Jane Sprandel,
Yes.
Jen Straub.
Yes.
Molly McClay.
Yes, and with that, the motion passes. Funding is approved. Next, we will move to Family First Advocacy Empowering Bridge Program. This is a new program requesting $233,355. Lynn, would you please share about the suggested scenario and provisions?
This one is also a suggestion to deny funding because it's a new program, and we know that they are in this community and they're trying to expand. So if you wanted to contract with them, we have some suggestions here for what to do prior to the contract and then during the course of the year, even a 2-year term. But because this would be funding a new program from an agency you don't have any experience with, seemed like not the year. So.
Thank you very much. Is there any discussion or would anyone like to make a motion?
I move to deny Champaign County Mental Health Board funding of $233,355 for Family First Advocacy NFP Empowering Bridge Program.
Thank you very much. Can I have a second?
Second.
Thank you very much. Straub motions, Joachim seconds. Any final discussion? I just wanted to say, this one was difficult for me all of these are difficult, but I said that this is really, if this is a program that kind of feels like an us program. And I hope that, with some, feedback through this process, as with everyone else, I hope they will come back and apply for funding next year. And also will, I really hope that the school districts will step up and help to fund this as well. Those are my comments on that. Does anyone else have any comments before we vote? All right, seeing none, the motion has been clearly stated. May we have a roll call?
Jen Arez,
Yes.
Elaine Palencia,
Yes.
Kyle Patterson,
Yes.
Jane Sprandel,
Yes.
Jen Straub,
Yes.
John Paul Joachim,
Yes.
Molly McClay.
Yes, and with that, the motion passes. Funding is denied. Next, we will move to First Followers, First Steps Community Reentry House, a returning program requesting $69,500. Lynn, would you please share about the suggested scenario and provisions?
There are quite a few things to do prior to the contract. Those are listed here. special provisions are the same. I think that we did add some greater involvement with coordinated entry system, but it's kind of weird because this group of people tend to come out of Department of Corrections, so it's different. They're not unhoused, but they can become unhoused. And so if that happens, we just want to make sure the agency is working more closely. This is, again, to strengthen the collaborative system and applications and maybe potentially get more federal funding if the need is more clearly described. So I think that's the only new thing. Is that right, Leon? You showed me the individualized service plans, but I think that was a continuing provision, right?
That is correct.
Okay. So this would be, again, for a 2-year term. Okay, that's it.
Thank you very much. Is there any discussion or would anyone like to make a motion?
I move to approve CCMHB funding of $69,500 per year for a 2-year term for First Followers, First Steps Community Reentry House, subject to the caveats as presented in this memorandum, and to authorize the CCMHB Executive Director and Board Officer to execute the agreement.
I'll second the motion.
Thank you very much. Palencia moves. Sprandl seconds. Any final discussion? All right, seeing none, the motion has been clearly stated. May we have a roll call?
Elaine Palencia,
Yes.
Kyle Patterson,
Yes.
Jane Sprandl,
Yes.
Jen Straub,
Yes.
John Paul Joachim,
Yes.
Jen Aras,
Yes.
Molly McClay.
Yes. And with that, the motion passes. Funding is approved. Next, we will move to First Followers, Peer Mentoring for Reentry, a returning program requesting $120,000. Lynn, would you please share about the suggested scenario and provisions?
For this one, when we asked that, I think we talked about this last week, I didn't really like many of the reductions that agencies offered to do. This was such a big reduction from their request, but they explained why they could do it. And then shortly after, I saw some kind of interesting movement of some potential state legislation that could kind of could improve the system around the whole state for people in reentry. So I'm hopeful that keeps moving, but even if it doesn't, they were comfortable with this lower amount. So, and it's just a little bit lower than what they've been receiving the last couple of years. So again, we stayed with the similar provisions with the addition of working with coordinated entry when it's appropriate, which I don't even know how often that is, but could be. And then the changes that are needed in the application forms.
Thank you very much. Is there any discussion or would anyone like to make a motion?
I move to approve CCMHB funding of $90,000 per year for a 2-year term for First Followers Peer Mentoring for Reentry, subject to the caveats as presented in this memorandum, and to authorize the CCMHB Executive Director and Board Officer to execute the agreement.
Thank you very much. I don't know if somebody else said second, but I was about to say second.
I could second.
Straub, were you saying second? We'll give it to Straub. All right. Ara's motions, Straub seconds. Any further discussion?
Just to Lynn's point, it did look like there was a reduction by 30,000 from the initial ask, and I think we as a board really appreciate that, and also the transparency of it being because their skill levels of their staff has increased to a point where they may not need to have consultants and contractors. I think that was very nice to see, and it does give me hope that this will not reduce their services.
Completely agree. Any other discussion? Oops. All right, seeing none, the motion has been clearly stated. May we have a roll call?
Kyle Patterson,
Yes.
Jane Sprandl,
Yes.
Jen Straub,
Yes.
John Paul Joachim,
Yes.
Jen Aras,
Yes.
Elaine Palencia,
Yes.
Molly McClay.
Yes. And with that, the motion passes. Partial funding is approved. We are more than halfway through these, but we're not gonna beat the DDB in terms of time, but they had fewer applications to approve.
And we have cookies.
You also have cookies and water. So please take part if you are needing nourishment. All right, we will next move on to GCAP, Advocacy, Care, and Education Services. This is a returning program requesting $113,878. Lynn, would you please share about the suggested scenario and provisions?
Just like a minor thing in the application forms. We'd like to see specific targets, but this one, again, is a continuing program, only just for the last couple of years, but we would suggest, again, a 2-year term for this one for stabilization. And then similarly, some relationship with coordinated entry system. This population cannot be included in coordinated entry, but they can use a system that's similar. And I think that you have established one, but we just want to make sure everyone's on the same track. So that's the only new provision in here. Oh, there's one other new provision. We just hope that the organization would be able to support the director because this was a very difficult year for her. So.
Completely agree. I think I also failed to say that it was a returning program. So Lynn, thanks for saying that. Is there any discussion or would anyone like to make a motion?
I'll move to approve CCMHB funding of $113,878 per year for a 2-year term for a Greater Community AIDS Project of East Central Illinois Advocacy, Care, and Education Services, subject to the caveats as presented in this memorandum, and to authorize the CCMHB Executive Director and Board Officer to execute the agreement.
I will second. So Joachim motions, McClay seconds. Any final discussion? All right, seeing none, the motion has been clearly stated. May we have a roll call?
Jane Sprandel,
Yes.
Jen Straub.
Yes.
John Paul Joachim,
Yes.
Jen Aras.
Yes.
Elaine Valencia.
Yes.
Yes.
Yes. And with that, the motion passes. Funding is approved. Next, we will move to Grow in Illinois, peer support. This is a returning program requesting $179,805. Lynn, would you share about the suggested scenario and provisions?
We've talked about it quite a bit. This is again a 2-year recommendation or suggestion, the same special provisions as the prior year contracts. And they've actually already resolved some of the budget issues. It did have to do with some state funding that I think the organization is not going to continue to access. Like, it's a tough decision, but they've decided. So then there's just a few other revisions in the application forms, specific targets, that type of thing.
So that's the suggestion is for like a slightly reduced amount related to some of the form errors or changes or whatnot. Is there any discussion or would anyone like to make a motion? I will go ahead and move to approve CCMHB funding of $171,805 per year for a 2-year term for Grow in Illinois peer support, subject to the caveats as presented in this memorandum, and to authorize the CCMHB Executive Director and Board Officer to execute the agreement. Can I have a second?
Second.
Thank you very much. McClay motions, Straub seconds. Any final discussion? Seeing none, the motion has been clearly stated. May we have a roll call?
Jen Straub,
Yes.
John Paul Joachim,
Yes.
Jen Aras,
Yes.
Elaine Valencia,
Yes.
Kyle Patterson,
Yes.
Jane Sprandel,
Yes.
Molly McClay.
Yes, and with that, the motion passes. Partial funding has been approved. I feel like we're starting to drag, y'all. So hopefully, I don't know if we need to do some jumping jacks, but feel free if you to get up, walk around, get a snack or whatnot. As long as you're back for the vote, that's And even if you're not, we do have a quorum. And so, all right. So next we will move to Habitat for Humanity Homebuyer Program. This is a new program requesting $229,560. Lynn, would you please share about the suggested scenario and provisions?
We're suggesting to deny funding, mostly this because it's a new program. Like I could go on and on about how hard that is to say, but okay.
Yeah, I think that I also wanted to see like a stronger emphasis on like working with individuals with mental health issues, even though we know the importance of housing stability for mental health. I think that like in the future, I hope this application comes back and strengthens that piece further. But again, this is really hard to have to deny anything. So I open it for discussion or for anybody to make a motion.
I move to deny CCMHB funding of $229,000, $560,560 for Habitat for Humanity Homebuyer Program.
I'll second.
Thank you very much. Ara's motions, Joachim seconds. Any final discussion? All right, seeing none, the motion has been clearly stated. May we have a roll call?
John Paul Joachim,
Yes.
Jen Aras,
Yes.
Elaine Palencia,
Yes.
Kyle Patterson, Jane Sprandel,
Yes.
Jen Straub,
Yes.
Molly McClay.
Yes, and with that, the motion passes. Funding is denied. Next, we will move to Promise Healthcare Mobile Clinic. This is a new program requesting $200,000. Lynn, would you please share about the suggested scenario and provisions?
We do have notes there. If you did choose to contract for this, we had a couple things we'd want to see, and those are listed, mid-year progress report. Again, the suggestion is to deny, and this is once again because of affordability. Although there has been so much good discussion, I've learned a lot.
Thank you very much, Lynn, and I do appreciate the comments from the organization earlier this evening. Again, this is just a very, very hard year, and I wish we had more money. I hope that the program will come back and reapply in the future and seek other funding sources as well. Is there any other discussion, or would anyone like to make a motion?
I will move to deny CCMHB funding of $200,000 for Promise Healthcare Mobile Clinic.
I'll second.
Thank you very much. Palencia motions, Sprandel seconds. Any final discussion? All right, seeing none, the motion has been clearly stated. May we have a roll call?
Jen Aras,
Yes.
Elaine Palencia, Kyle Patterson, Jane Sprandel,
Yes.
Jen Straub,
Yes.
John Paul Joachim,
Yes.
Molly McClay.
Yes, and with that, the motion passes. Funding is denied. Next, we will move to Rosecrans Central Illinois Behavioral Health Urgent Care. This is a new program requesting $360,000. Lynn, would you please share about the suggested scenario and provisions?
Yes, but I'm starting to panic about things like, is it recording? So this was probably the most discussed of all the programs, and we do suggest denying funding for this program, again, because it's new, but it's also the largest, I think it's the largest of the requests for new funding. Yeah, so.
Thank you very much, Lynn. I know this was very painful for me as well because I have known how much our community has needed a program for this for a long time. And I tried to calculate out any scenario that would allow us to fund it. But even the scenario that would result in a lot of other programs not getting their full request still could not mathematically provide more than even like half of the requests, and that doesn't seem fair to the program. You know, we want it to reach as many people as possible and have the hours that it would need. So this is very painful. I do hope that the state and federal systems will step up and provide the needed funding for this program, and I hope they will consider coming back next year. Is there any other discussion, or would anyone like to make a motion?
I'll make a motion to deny CCMHB funding of $360,000 for Rosecrans Central Illinois Behavioral Health Urgent Care.
I'll second.
Thank you very much. Sprandl motions, Joachim seconds. Any final discussion?
I agree. This was a hard vote.
Hmm.
I hope next year they'll apply and we hopefully will have some more funding.
And I know the program is getting off the ground and will be able to exist in some form, even without our funding. So that is also good. Any other discussion? All right, seeing none, the motion has been clearly stated. May we have a roll call?
Elaine Palencia,
Yes.
Kyle Patterson,
Kyle's, for the record, Kyle Patterson said yes, was not at the microphone yet, but is yes.
Jane Sprandl.
Yes.
Jen Straub.
Yes.
John Paul Joachim,
Yes.
Jen Arez,
No.
and Molly McClay.
Yes. And with that, the motion passes. Funding is denied. Next is Rosecrans Central Illinois Benefits Case Management. This is a returning program requesting $181,000. Lynn, would you please share about the suggested scenario and provisions?
This is another suggestion of full funding for a 2-year term, and I'm prouder than ever of myself for not wasting your time going on and on about Medicaid, but that is why I think full funding is a great idea for this. There are just a few things to do in the application forms prior to the contract, and then no new special provisions. They're all continuing.
Thank you very much. Is there any discussion, or would anyone like to make a motion? I will go ahead and move to approve CCMHB funding of $181,000 per year for a 2-year term for Rosecrans Central Illinois Benefits Case Management, subject to the caveats as presented in this memorandum, and to authorize the CCMHB Executive Director and Board Officer to execute the agreement. May I have a second?
I second.
Thank you very much. McClay motions, Palencia seconds. Any final discussion? All right, seeing none, the motion has been clearly stated. May we have a roll call?
Kyle Patterson,
Yes.
Jane Sprandl,
Yes.
Jen Straub.
Yes.
John Paul Joachim,
Yes.
Jen Arez,
Yes.
Elaine Palencia,
Yes.
Molly McClay.
Yes, and with that, the motion passes. Funding is approved. Next, we will move to Rosecrans Central Illinois Recovery Home. This is a returning program requesting $200,000. Lynn, would you please share about the suggested scenario and provisions?
This is again a 2-year recommendation or suggestion, but for $125,000 instead of $200,000. The agency did describe how they could, what would happen if they had a lower amount. And I think in most cases we tried to stick with the original requests, exception in this one. So if they were to deny the offer of a 2-year term, I would understand that. But I think it's, this is another one where we have a good track record. So continues the same special provisions, just a few changes in the application forms.
Thank you very much. And I think the rationale for the decrease was also one that I think is a combination of it being well stated and understood where there wouldn't be as big of an impact on services, and because, you know, mathematically speaking, we wouldn't be able to fund this one fully. But I know that any of these like partial ones are difficult, and luckily we've not had to do too many of them. Or is there any other discussion, or would anyone like to make a motion?
So I would also like to point out, just for full transparency to anyone watching and all that, they did state that reduced funding would require selectivity in admitting residents who require supplemental assistance with program fees due to employment instability or other financial barriers, which may modestly impact overall capacity. In addition, while the original request included dedicated staffing for therapeutic recreation, these activities would continue at a lower frequency by supporting the position through other grant funds and appropriately allocating staff time across funding sources. And I would like to share a staff comment from the initial application that states, with the changes in current landscape, it is very important that staff receive the support they need to serve another demographic that has not been served, along with a demographic that is challenging to engage in mental health services. Just before, we make a decision on whether to reduce or not, might be helpful to know.
Thank you very much for sharing that. I will open it up to further discussion, or if anybody does want to make a motion about, I think a little more discussion on this might be helpful.
I would counter that again. This is an agency that has many sources of funding, and we are not their only source of funding, or shouldn't be. So my worry about funding this at a lesser amount than originally requested is not as big as it would be for some other agencies.
Thank you very much. Other discussion? I just would say, if we did want to fund this at a higher amount, we do not have very much wiggle room with what has been proposed thus far. So we would have to make a reduction to one of the applications that has not yet been voted on in order to do that, unless we were funding like a very small amount extra, and we could potentially use fund balance for that, but we only have about 22,500 and as that might go into fund balance, which is not very much. So I don't know if anybody has ideas or other comments that they would want to make on this one, or if anybody wants to make a motion now.
I guess the question I'll bring up is, just remind me again, why did we come to a consensus on decreasing the funding amount?
Can you say that again, John? Sorry, it's a
So,
little hard to hear.
Just what was the reasoning again for this year for decreasing the funding amount versus previous years for this?
Well, it came in at 100,000 initially, and they said they would only need it for 2 years, and then went up to 200,000, and then it went back down to 100,000. So I think that's right. So this would be going back up to 200,000. So it has gone up and down, and I think the results have improved over time too. So it's been okay, but they provided. I appreciate y'all going back through the details of how they could do with less and what would change. I'm having a little bit of, looks like my Zoom is crashing, so I'm getting a little bit distracted here. Sorry.
I don't have my books from last week, but I can't remember how much did we fund last year.
It was 100 for the last 2 years. Yeah.
So there's a 100% increase in the request. Okay.
So we would still be giving them an increase from a prior year. It just wouldn't be the doubling that they were requesting. Is there anyone else who would like to make any comments, or does anybody want to make a motion?
I'll go ahead and motion to approve Champaign County Mental Health Board funding of $125,000 per year for a 2-year term for Rosecrans Central Illinois Recovery Home, subject to the caveats as presented in this memorandum, and to authorize the Champaign County Mental Health Board Executive Director and Board Officer to execute the agreement.
I second the motion.
Thank you very much. Straub motions, Palencia seconds. Any final discussion? I did want to note that that Rosecrans also had, for the benefits case management, provided a rationale or a possibility of lowering that scenario, but it was we opted to not do that. The amount by which the request was being lowered was much less, and I think that potentially was part of it too. Is that there's the amount of change that it would be is just so great, and we don't. Mathematically, we just can't make it work to do all of it unless we make drastic other changes. Is there any other discussion before we vote? All right, seeing none, the motion has been clearly stated. May we have a roll call?
Jane Sprandel,
Yes.
Jen Straub,
Yes.
John Paul Youakim,
Yes.
Jen Aras,
Yes.
Elaine Palencia,
Yes.
Kyle Patterson,
Yes.
Molly McClay.
Yes. And with that, the motion passes. Partial funding is approved. We are getting close to being done. We're at the letter U now. So the next one is Uniting Pride of Champaign County Children, Youth, and Families Program. This is a returning request for a returning program requesting $225,056. Lynn, would you share about the suggested scenario and provisions?
I am no longer able to control the Zoom meeting, so you're going to have to bear with me, and hopefully you've got the packet in front of you. I apologize to the Zoom participants. I cannot do anything about it. It's stuck, so I'm just glad it's still recording. So the recommendation or the suggestion from staff is, again, a 2-year contract for the requested amount. There are just a few really small discrepancies to correct in the personnel form. They it kind of made it seem like a much bigger deal than it was. It's something about the form itself. So I want to apologize for that. The special contract provisions are continuing from prior years, with the exception of just getting it on the record that you approve them getting the financial review for the amount they are being charged, which is a little bit higher than the threshold, which we should probably just remove the thresholds from our funding guidelines. But we can't right now. So anyway, that's the staff suggestion.
All right, thank you very much, Lynn. Is there any discussion, or would anyone like to make a motion?
Sometimes it doesn't. All right. I'm moved to approve CCMHB funding of $225,056 per year for a 2-year term for Uniting Pride of Champaign County Children, Youth, and Families Program, subject to the caveats as presented in this memorandum, and to authorize the CCMHB Executive Director and Board Officer to execute the agreement.
I'll second that.
Thank you very much. Palencia motions, Sprandel seconds. Any final discussion? I just wanted to state, I know when they had came back and they talked about how what would happen if we left them at their current year funding. It would, make it difficult for them to reach the current need and expand in areas that are needed. And when I was looking at the quarterly reports, they far out did their have already outdone their targets, and it's not even the end of the year. So to me, that was evidence of why this expansion is needed right now, especially with this community under attack in so many ways. Any other discussion? All right, seeing none, the motion has been clearly stated. May we have a roll call?
Jen Straub,
Yes.
John Paul Youakim,
Yes.
Jen Aras,
Yes.
Elaine Palencia, Kyle Patterson,
Yes.
Jane Sprandal,
Yes.
Molly McClay.
Yes, and with that, the motion passes. Funding is approved. Next, we will move to We Never Walk Alone, Trained First Responder Peer Support. This is a new program requesting $20,330. Lynn, would you please share the suggested scenario and provisions?
The suggestion is to deny funding for this application. I'm sorry, I've got to trying to solve this.
Understandable. I'll try to fill in. I know this was a new application. In addition, the organization not currently eligible for funding. So is there any discussion or would anyone like to make a motion?
I move to deny CCMHB funding of $20,330 for We Never Walk Alone, trained first responder peer support.
Second.
Thank you very much. Ara's motion, Straub seconds. Any final discussion? Seeing none, the motion has been clearly stated. May we have a roll call?
John Paul Joachim,
Yes.
Den Aras,
Yes.
Elaine Palencia,
Yes.
Kyle Patterson,
Yes.
Jane Sprandal,
Yes.
Jen Straub,
Yes.
Molly McClay.
Yes, and with that, the motion passes. Funding is denied. We will next move to We Never Walk Alone, Vetted Mental Health Professional Network. This is also a new request for $19,656. Lynn, would it be helpful for me to talk about this one?
This is also a new request, and the suggestion is to deny mostly because it's new. It's very affordable, but there were some issues that might take some time to resolve toward eligibility.
Thank you very much. Is there any discussion or would anyone like to make a motion?
I'll make a motion to deny CCMHB funding of $19,656 for We Never Walk Alone Vetted Mental Health Professional Network.
I will second. Sprandal motions, McClay seconds. Any final discussion? Seeing none, the motion has been clearly stated. May we have a roll call?
Den Aras,
Yes.
Elaine Palencia,
Yes.
Kyle Patterson,
Yes.
Jane Sprandal,
Yes.
Jen Straub,
Yes.
John Paul Joachim,
Yes.
Molly McClay.
Yes, and with that, the motion passes. Funding is denied. Just have two left. The next one, they're a little out of alphabetical order for a reason that we'll get to, but so the next one is Wind Recovery, Wind Resilience Resource Center. This is a new request, although they did apply last year as well. The request is for $270,000. Lynn, would you share about the suggested scenario and provisions?
The suggestion is to approve it at the adjusted amount that the agency provided information about other funding so they could lower the request. And we would say, take it. And then, but only do it for 1 year because the other application that this small organization submits is on the other 2-year cycle. And I think it was a little bit difficult this year to integrate them completely. So it might be nice if they're on the same cycle. But anyway, special contract provisions are similar to the ones in the other agency contract. But again, we've added this like deeper collaboration with the continuum of care. And I don't know if coordinated entry would be relevant here, but probably so, like similar to first followers, it could happen. And then we would like them to develop specific targets for the outcomes. The financial form revisions would be necessary because the application was for $270,000 and now they're lowering it to $210,000. So they have to do those adjustments anyway.
Thank you very much, Lynn. I know we had a lot of discussion on this and I welcome additional discussion. I know for me,